Oh my gosh.
I know, Stella. I know. I know. Hey, everybody. It's Dr. Sandy, and I have Deanna and Misty with me. It's so wonderful to have everybody. And I think we're absolutely live. It's that fast. Totally. Let me go ahead and somehow mute this. All right, there we go. So I wanted to introduce everybody to Stella. She is our Nurses Against Violence puppy. She is our new mascot, and I'm going to get her little hat and everything as she gets older. She's going to be real cute. So whether you like dogs or you don't, look at that face. Oh. All right, so I'm going to put her down. And so what we're going to talk about today is, it's very important because as every topic that we talk about, and I want to talk more about COVID trauma and about how it is so interrelated to combat trauma. And, people automatically get defensive and they get upset when I relate it to COVID. To COVID to combat. And well, let's take a look at that, right? So back in World War II, we had nurses taking care of soldiers, right? So when we had the nurses taking care of soldiers that were getting injured on the field, they would see this massive amount of casualties and massive amount of death, and it's so relatable to what we see right now. So when they talk about, we hear a lot about people talking about, it's a part of the job. Nurses, it's a part of we learn this in nursing school. We learn how to take care of massive amounts of people. This is a part of our job. Well, I hate to tell you, but in nursing school, I teach nurses, and that's not a part of the curriculum whatsoever. And so we have new nurses that are coming out in the field, not even finishing their degree or even taking their test, working on patients to try to keep up with the massive amounts of trauma, the massive amounts of the pandemic that we are suffering. So, Misty, I think you're about to say something, so I apologize.
I was just going to say, I think, nursing school feels like forever ago, even though it's only been 6 years for me since I graduated. And I think we grazed on mass casualty trauma protocols, like something about a black
tagging,
tag, green tag, or whatever. And I think we talked about the 1918 Spanish flu pandemic for like 30 minutes.
Mm-hmm. So how are we preparing our nurses out there, Deanna?
Sorry, I just want to add to that. Nursing school did not teach a lot of that. It was like 6 slides, I think, for me.
Yeah.
But the ER covered that a lot more than nursing school ever did.
Oh, yeah, most definitely, right? Because you have we had Ebola not too long ago, right? And we were preparing for that.
Yeah.
Yeah, when I was working over at a big name brand hospital, like a big one over in Baltimore, and I was on the Ebola team. So I was doing all the preparation and getting people ready for that. And anytime that person could come in, and we had to be ready. So we had drills, we had all kinds of things. Well, we didn't really have that much of a drill. As soon as we heard that it was over in England or over in Europe for this COVID stuff, it was already here, especially in Florida. I already knew it was there because all the people come from everywhere to go to Florida and go to Disney World, go to all of those places. So we cannot discount the fact that it's probably even been here before we even thought it was, just like HIV was. It was here for a while. And not until there was massive amounts of death and they started putting things together. Well, let's see. And sort of like how the pandemic laid out, right? We still don't know exactly what's happening. Now, I know you both have a lot to say about what's happening with COVID, but I want to stay on one little topic that I want to finish with this. So when we have COVID trauma, what difference is that? What is it about COVID? Why am I talking about COVID trauma? Well, it's the same thing as combat trauma, right? Nurses were out in the field and they were taking care of soldiers, right? Nurses were out there. Did they have mental health care when they came back? Probably with the VA, right?
Even then, the VA was super unready for that.
Right, exactly. So we have military nurses that have been doing this for years, right? We probably have learned from in nursing school, right? And then but they've had this combat trauma, right? If they have been in a war setting. A lot of the nurses have not been in a war setting. If they're from, back in World War II, then they had like Vietnam, then that's where kind of like, unless it was like Desert Storm and stuff like that, there wasn't as many as there were with Vietnam, right? So in relation to combat trauma, it's the same scenario of massive casualty is where I'm going with this. COVID trauma has not just affected nurses and our frontline healthcare workers, has not just affected just that category. It's affected doctors. It's affected so many lives outside of nursing and healthcare. And I want to talk a little bit about that as well. So we have combat trauma. What's the relation? It's all the same. Trauma and trauma. Just like people are talking about trying to reinvent burnout and PTSD and calling it moral injury. It's the same thing when it comes down to the principles. Stop changing it, right? COVID is an illness. It's a pandemic. It's something that's out there, COVID-19. And we have tried to adapt, and we have been trying to find out where it's coming from, how it's affecting everybody. You could have a house full of people. One person gets acutely ill. Everybody has the same COVID strain, and it affects every single person differently. One person dies. One person has somewhat severe symptoms, and the rest may be completely asymptomatic.
Absolutely.
Now, let's talk about how COVID trauma has affected healthcare workers. We're going to touch on that first. Yeah.
How much time we got?
So COVID has affected my family, which is healthcare, so deep to the core that we have nurses that are leaving the floor in groves. And this is not being over the top in statements. This is not trying to be, oh, this is not bad, I need attention. No. Data has not even come up to show. Nurses were already leaving nursing, but not as much as they are right now. If not the floor, into different professions of nursing, because they didn't want, they like nursing. They want that theory of really caring about people. That's what they thought it was when they got into it.
That's what I'm doing.
Yeah, they learned in nursing school how to be evil towards each other, how to be cantankerous towards those trying to learn underneath of you, those that are learning from you, right?
Day one, I kid you not, day one of my nursing orientation for my nursing program, they said to me, "This is not a weeding out process." Yes, it is.
That's automatic, right?
Not just that, literally day one, look to your left, look to your right. Those people won't be here when you graduate, and it might not be you.
They totally said that to me. They totally said that as well. Like and they said, oh, well, don't get pregnant. Don't have any life events. Don't do this.
Don't work.
Don't get sick. Yeah. Don't plan any vacations, because you ain't going to have no vacation. You're going to be working on your days off. You're going to
had a life. You don't anymore.
You have
because
kids?
Nursing school is your life.
Are you sure this is the right step for you?
Yeah. Oh, you're pregnant? Then you have to drop out. I'm sorry.
Oh, you're a single mom working a full-time job? I'm going to deliberately fail you until you do what I think you should do to pass nursing school.
Oh. What about that magical box? How does that start? How do we start conditioning people to be what we want them to be?
Day one of nursing school, when you learn not to trust anybody, because anyone and everyone will snitch to get in better standing with the teacher.
So they put you in a box. Close the lid.
Yeah.
And stick you on the shelf.
I have you modeled. I have you conditioned to be the perfect robot that we want you to be, and to pass all kinds of pharmaceutical medications and pharmaceuticals. And this is nothing about holistic, nothing, it's all irrelevant. Let's turn the patient, get that red spot from going away. And we need to make sure that we have our IV set right. We have, it's just, the list goes on.
Yeah, they train you to work the floor. They don't train you to work ICU. They don't train you to work ER. They don't train you to work anything not hospital. They train you to be a robot into what the hospital needs.
Yes, you're a box
Yep.
checker and a task doer.
That's it.
Right.
They don't
So-
train you that research positions are available. They say you have to get a higher education for that. I'm sorry, she's got an associate's degree.
So how is this affecting the 2-year nurses? I don't know if you saw the article that I posted, right? That legislators are still continuing to diss 2-year nurses.
We did more skills hours than bachelor hours.
Well, I'm just saying, I've been there, done that.
When I take a step back and I listen to somebody like that, the first thing I wonder is, how educated is this person actually? Do they understand that whether I go through a school and get a master's degree or a associate's degree or a bachelor's degree, or whether I've completed a hospital's diploma program, that all 4 categories sit for the same state national licensure exam? They all sit, they take the same test. The passing threshold is the same. So on a clinical skills level, all of those people are adequate. The difference between maybe an associate's and a bachelor's and a master's of nurses is the amount of extra history courses or extra English courses or math courses. But then you get into your master's programs where you get into those really specific nursing theory courses. But you still sit for the same exam for the clinical skills aspect of it, right? I mean, there's a different one for NP, right?
Yes.
Yeah.
But I'm talking about for your RN license.
You still take the same.
Everybody's the same. It's all the same. Bachelor's degree and associates. It's a different higher level thinking, and the bachelor's program, I believe, should be all one. I believe the nursing program should be 4 years, because in all actuality, with prerequisites, they should all be intertwined in that 4 years, and stop making people force and getting 15-hour credits each semester in order to be able to get into the program. It should be a 4-year program all the way through, and they should be able to have their prereqs done during that time. Stop telling people that it's only a 2-year program. It's not a 2-year program. Add on those extra classes instead of all those electives. Allow these kids to go to, or adults, to be able to go and take those electives even before they even get in, if they want to learn more about psych. Like what I did was I wanted to learn more about how the mind works, because I've always been drawn to never thought I would be in psych, but I just like the abnormalities. Like I like to be able to meet people where they are, talk to them, and for them to feel comfortable enough for me to be able to take care of them. I don't know everything, but the fact of the matter is the 2-year program is a great introductory program. And I believe that the 2-year is still a very good program, but it does need a lot of revamping. And if we can get a hold of it, even with Nurses Against Violence, if we can help, not deconstruct the whole thing, but to help it out, to intertwine a lot of the newer theories and the things that need to be learned as far as like societal trends, if we can instill those into the programs. There's a lot of great programs out there that are 2-year.
I agree.
But there's a lot of programs out there that just have people that have been off the floor for 30 years that are building this curriculum. You have your PhD track, right? And then you have your DNP track. DNP is doctor of nursing practice. The PhD is research based. They're not mingling. They're not talking together. They're just kind of like, okay, so this is the curriculum. This is the way it is. And I haven't been on the floor, but this is the way it always was. And this is the way it always will be. Mindset. So to get back to how the 2-year nurses are out there saving so many people and haven't even taken their boards yet. And I think that Deanna.
I'm sorry. I have a 2-year degree as well, but I had a lot of my prerequisites done before nursing school.
Same did I.
The only reasons that I had to, and that was about 1.5 to 2 years before I ever got into nursing school. So the nursing school portion itself was the 2-year degree because I took the associates.
Mhm.
But I had to take a couple of the other core classes because that school wanted this done this way.
Mhm.
And those credits wouldn't transfer because how nursing schools will fight back and forth. But
So if you look at it, a regular associate's program is 2 years. If you look at your prerequisites, and we can get on this in another time because we're talking about, you know, how COVID trauma and stuff like that. But
Right.
we have, like myself, I took about 1 year doing prerequisites, and then I got into the 2-year associate's program. Okay. That's not 2 years. That's not 2 years. That took a lot longer than 2 years. So it needs to be, something has to get done, and we have to get it done.
We're
We have to
relabeling.
start making noise. Huh?
A relabeling almost.
Yeah. Like let's work together as a team, and let's try to make it more innovative.
Right.
Innovating nursing education to meet societal trends and to make sure that nurses are learning real-time issues, not
This is what we did 30 years ago.
Right. To come back around to what you were saying, though, Sandy, when that representative comes out and says, I don't want some 2-year nurse taking care of me, they're inadequate, essentially. They're not trained properly, and I just don't want some Joe Blow off the street coming to take care of me, or whatever it was that representative said. It's from my experience, she's associates prepared, I'm associates prepared.
Mhm.
Probably at least 50% of the nurses that I've worked with are associates prepared nurses. And I'm not here to say this fight between bachelor's prepared ADN nurses versus BSN nurses is part of what tears us apart. And we don't need any other higher government officials coming in and throwing that as a wedge in between us anymore, because that is already a battle we have every day.
And that's what was pre-COVID. That was pre-COVID already happening.
To put that out there right now, you know, at the end of the day, the hospitals put these wonderful signs out here saying heroes work here, and the Sprint puts out a message thanking nurses and doctors, and the airlines gave away free tickets for a while, but it didn't matter when it came to taking care of our patient population. ADN nurses stepped up, diploma prepared nurses stepped up, BSN nurses stepped up, master's nurses, NPs worked the floors when they couldn't find other
Doctors
jobs.
worked the floor.
Doctors worked the floor. I watched the
Physiologists.
whole medical community come together to take care of this group of people, almost like a medical 9/11.
This is the way it should be.
It is.
Yeah. My uncle's a nurse anesthetist, and he's working the floor right now.
Nobody really
Yeah.
cared what your degree was. They just cared that you had the skills to take care of these people.
Right. And those that are condemned for having a higher degree when they're out there trying to do the best they can. Or even haven't even gotten started. So it just depends on, or, you know, haven't gotten started at that job.
Right.
But so when we talk about COVID trauma, we've established that. So we have people stepping up to the plate every day. We have people that are working, you know, it could be a little bit scary when you have somebody that's worked in ortho, that's working in mother and baby, right? Out of their scope of practice, but that's what's happening. Happening.
You could end up with a broken hip or a broken back from labor, I'm sure. And they're
Just saying, you got a broken back, man? Okay, let's take care of that. So, but we've had nurses that have taken on and have practiced outside of their scope because COVID is unknown. This is our World War III. You know that. Mm-hmm. People are like, oh my gosh, Sandy, you're so like, woo, like out there. No, for real. This is our World War III. We've been fighting it with needles, masks, if we have any, if they're not dirty or if they're not reused, trash bags for gowns.
Right. Or
And
clock
then
down
when
for
we
longer
say
regularly.
something, goodbye, because we don't want your thinking, because we have everybody else thinking the way we want them to think, because they're here in the box, right? So this is our 9/11. This is our World War III. And it's not going to end anytime soon until we get this thing beat. When we do, how many nurses and healthcare professionals are still going to be standing?
When we're drawing parallels between COVID trauma and combat trauma, the only difference really
Go ahead and keep on going real quick. Go ahead.
is the gore. You know, with COVID trauma, and people think that. So recent experience for me, people talk about, oh, well, the soldiers risk their lives. Well, so do these nurses that are fighting COVID. Oh, well, the
Right.
soldiers see a lot of death. Well, so do these nurses that are fighting with COVID. Oh, well, the soldiers see a lot of blood and trauma. Well, guess what? So do these nurses that are fighting COVID, because let me tell you, with my last one that died, when we were doing chest compressions on her, she had fluid shooting from her ET tube that was bloody, that got all over everybody. So we experience that kind too. We might not see flesh hanging off of bones, but it's still really physically traumatic.
Absolutely. And you know what? Those nurses that are out there having people that are dying every day, they're doing the best they can and seeing massive amounts of death. We talked about a couple webinars about how ago when we talked about one person and how on a normal basis, one person can change so many lives, right? That's why I became a nurse. That's why you became a nurse. That's why Deanna became a nurse, to change lives, to do better, to find that hole that we're missing in our own life, to make it better for somebody else, right?
Which most times a nurse made us realize that, hey, most of us got into nursing because of another nurse.
And a lot of times, yeah. I did. It was my grandma's hospice nurse.
It was my L&D nurse when I had Lexi.
Well, that wasn't my case, but I mean, that's really awesome though. I worked with some pretty kick-ass nurses in Buffalo though, and that taught me some pretty great stuff. So I really appreciate that. Here, come here, Rosaldi, you need to hold this down. Sean's like squirting out. No, you need to put some pressure on that. Okay. I mean, they loved me because I was always there and I was ready to get dirty if I had to. And I still am. Like, I have and that's what we need more of. We need more of the nurses and that are in higher positions and the leaders, as well as also the ones on the front line, the nurse practitioners, the DNPs, the research-based nurses need to get it together. Stop thinking you're above everything and get dirty and start changing this nursing practice. Because I'm going to tell you right now, there's not going to be nobody to take care of us on the floor.
Right.
There will be.
Take care of us on the floor.
But I'm just saying, if you really think about it, one nurse seeing over 1,000 people die just since COVID starting. Well, how about we flip that and one nurse affects even more than that in a positive way.
Right.
First, by taking care of themselves, right? Mm-hmm. So I'm going to flip this a little bit. Now, we hear a lot and we talk a lot about how nurses are having all of this trauma, that are having all of these things. And you see, nurses being brave and standing in front of, we have like, I don't get into public politics, whatever. Okay. Fact of the matter is, we have people that we felt disregarded, masks, they still do, right? And we have people that, but do they really know? Do they really know? Right? It's impeding on their freedoms. It impedes on our freedom when we have to wear a mask 24 hours a day, 7 days a week, whenever we go on the floor. And now we got to wear a mask out in public. It impedes on our freedom as well. But we understand. We cannot condemn the public because of the ignorance that's out there. It's not their fault. They don't understand. So either we can face it and get mad at them and be a part of the violence, or we can sit there and say, you know what, I respect what you have to say. It is impeding on your freedom. But let me tell you a little bit about what's happening in healthcare. Would you mind hearing about it? And if they don't, and they say it's a part of the job, okay, thank you very much, walk away. Because if you entertain that, all you're going to do is hurt yourself. So I'm going to read you something. It was actually one of my daughter's friend's parents, step parent, that was on Instagram talking about, hailing Brady for not wearing a mask in public and all of that hoop and holler about not wearing a mask and impinging on freedoms and blah, 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 blah. Okay. I'm going to read you something. And I wanted it to be a simple little statement, but then it turned into like one of those books that I didn't realize. And I'm going to be posting this on the page. So would you guys like to hear about it? Would you guys like to hear my response?
Sure.
So this is how I respond to a lot of people that don't understand. I thank them for what they have to tell me. Nurses are not prepared to effectively work with those going through trauma or that don't understand. Is it our job to teach people, the public, on what's going on? We are educators, whether we like it or not. We educate and we talk about things that are happening to the patient, what's to come, and how they're going to be after like a procedure. We do this. We have to. We talk about hand washing all the time, right? So this is how I respond. I truly appreciate where you're coming from. It is impeded on many freedoms. Here is the flip side. And this is me responding as my daughter, so just humor me. Here's the flip side. My mother has been in nursing for over 30 years. Her organization works with nurses and healthcare workers that are suffering epidemic levels of trauma, saving lives and losing thousands due to how different the virus attacks each individual differently. A house that of those who have COVID can have one person completely symptomatic and others either living either with simple sniff to nothing at all. That one family member dies, possibly the healthy one. Nurses and frontliners are leaving healthcare either in body bags themselves or the profession altogether. It is a healthcare failure with nothing protecting them to care for us. Referring to like third person, my daughter, right? This is her supposed to be responding. They were not trained to handle the massive amounts of loss, and it is not a part of the nursing curriculum or the job to have massive casualties on a daily basis. This is a fact. This is a huge factor and weight moving forward on the healthcare system. Those infected suffer varying levels of clotting that diet or any healthy lifestyle does to prevent strokes, heart attacks, or mental illness that it leaves behind, just with the virus alone. So yes, you have the freedom, but consideration for my mom's profession and for those that care for us should be a huge factor, as anyone that gets sick, there may not be enough staff or those with expertise to care for you adequately. And of course, my 17-year-old probably doesn't talk like that, but if you were wondering, my mom has nurses that have seen and cared for thousands isolated from their families, both worker and patient, minimal contact with their patients per facility guidelines for the illness, patients dying alone, taking their last gasp with their loved one next to them, without their loved one next to them to hold their hand. Who is there? It is the nurse and the nurse's aides, if within the guideline and protocol to care for you. Nurses are told to stay within 15 minutes to help a patient turn, do interventions, and all the nursing duties in this time frame with minimal human touch and interaction that you or anyone that you live with will be allowed. Anyone that you live will be allowed unless your advocate and friend, the nurse or nurse's aide, breaks policy. This tries to bend the rules to be by your side with their life, job, and livelihood in jeopardy. They signed up for this, they cared for you, and they care for you. Yes, You have rights, but do you truly care about those who are caring for you and those that love those that you love? If you're wondering, my mom sends her well wishes to you, and know that no matter what ignorant statements that are said, it is with a great kindness and respect that you respect and take in consideration those lost who are fighting to save lives on a daily basis for employers that do not take your health, safety, and those who care for you into consideration. You will look at your nurse one day and say, I wish I knew what I know now. I would have listened, thanking them on your last breath.
That's a pretty powerful statement. I think I can kind of feel where that's coming from, because I find that over the last year, like initially, oh my gosh, COVID hit, and I was so excited to get in the ring and fight this thing, and I was going to help save these people, and I was going to help make a difference. And then it started to drag on, and more people started to die, and I was like, man, I'm getting really tired. When is this thing going to be over? And initially I was working 36 hours a week, and then I was working 48 hours a week. And sometimes I was working 60 hours a week. And I hit that 60-hour week mark, and I was like, whoa, breaks, y'all, this is not healthy. But not all of the nurses have done that. And, we've had this discussion kind of before between you and I, between Deanna and I, where, and I feel really strongly about this right now because I'm still in the midst of it, is the people, the general public, they don't understand. They don't understand what it's like to hear the zipper on the body bags. They don't understand what it's like to see a pallet of bodies put into a refrigerator truck at one time. They don't understand what it's like to leave at 7:15 at night and come back at 6:30 again the next morning, and half your patients have died. And now you have 15 new patients that you don't know anything about, except they're also probably going to die. So, you want to educate people. And I find myself being in this place between, do I want to educate them or not? And I waver from complete and total apathy. Oh, Darwinism at its finest, like God sort them out, all the way to, I want to strangle you. Don't you realize there are whole families admitted to my unit right now, and they're dying. People are losing whole branches of their family. Are you that stupid? Sometimes that's what I want to yell. And I don't mean it that way, but that's how I feel. So instead of doing one or the other, I find myself doing nothing because I don't even know how to approach it some days without letting it get to the other side of me, where I might say something that's harmful to the public's perception of what needs to be done.
I feel like, and that is what we don't, and what we strive to not do, is to make it worse with Nurses Against Violence. And it's hard when you're submerged, right?
It's very hard.
You're now not going to be submerged anymore.
I know.
Right? But you have that trauma that will always be there, and trying to work through it.
Yes. And I struggle to understand how a whole community can disregard the experiences that their medical community is going through and just be like, whatever, it oppresses my right to freedom to wear a mask, or whatever, I don't care. This thing's fake anyways. They're just trumping it up and fluffing the numbers. And
let's meet them where they're at.
I'm struggling with that right now.
And it's always going to be a struggle, because sometimes you can't. This is almost like, there's a saying that one of my most favorite motivator, business mentor type person would always say, you can't, can you motivate a rock? Why?
Because it's a rock.
And you're just motivating a rock. So, it's kind of like the same thing, but so for those that are not on the front line, there is a way to take this message and make it better, because the ones that are on the front line are hurting so bad And this is what we do with Nurses Against Violence. We take you guys in and we hug you and we love you as best we can, because we're not there, right? But we have the empathy and we give a shit, excuse my language, about you. And we want to make sure that you're good, excuse my language. But this is absolutely paramount, because if you're not taken care of, we have a very crippled system. Now, let's also take this another step. Look at healthcare. Do you think the general public is going to trust anything that government people say, or anybody that has misled them? Do you really possibly think? Look at the CDC when they first came out telling us to put on bandanas. Are you serious?
Yeah, I'm
Like,
to that with the WHO coming back out now saying, oh, well, it's definitely came from animals, when before they were like, oh, it came from the lab. And then they were like, oh, it came from the wet market.
well, they did have it in the lab. They did have it in the lab. They have everything in the CDC. They have everything. They're working on things that you don't even want to know about. Right? So, but they don't talk about it.
We don't.
Well, we don't want to, we know, we know, well, you know, and I don't want to sound cynical, but we know there's bad things that are out there that we don't really want to know about, right? Because we want to stay in our little, right? We want to stay comfortable in our little box because we don't want to know about that. I don't want to know about that. Okay.
I don't necessarily want to stay in my box about that.
I want to stay in my box. I want my bubble back.
We're smart enough to know what they're thinking, but I don't want to know how bad of a strain of Spanish flu they're working on. I don't want to know.
No more. I think after this, I think it's going to be a while yet, and I seriously believe that we have something with Nurses Against Violence that we can relate on to everybody in every situation. Because let me tell you what it comes down to. This is what it comes down to, guys. Trauma.
It is.
And we have, and mental health, people that disregarded mental health and that said that they weren't mental health nurses, that it didn't apply to them. Now those people are the ones that are getting burned out. Now,
Right.
How is their mental health?
And I'm going to tell you, being in it right now, being in the mix, I personally am an open book, but that's because I come from a place of recovery. I come from a place of addiction recovery, and part of addiction recovery is being blatantly open and honest. It's having transparency to the level of every detail in your life. So for me, I am 100% okay telling the people around me, I am not okay.
Mhm.
Right. But there are so many people that are not okay saying, I'm
Mhm.
not. They're
Exactly.
embarrassed about it. They're
Mhm.
ashamed about it. And I'm here to tell you guys right now, it is okay to not be okay. And it is okay to seek out help. And it is okay
Mhm.
to have moments of weakness. And it is okay. What is not okay to do is it is not okay to be quiet about it. It is not okay to shut up about it. And it is not okay to let your personal family lives and your professional relationships suffer and the quality of care suffer because you can't see what's wrong.
To build on that, it is okay to say, no, I won't pick up a shift. It is okay to say, no, I'm not staying late. No, I'm not coming in early, because you are not abandoning or hurting the people that you work with, that you care about, like your family. Management's doing that. It is okay to say no and say, I've had enough and I need the break.
I would like to say something about management. And if you're listening, we are not against healthcare facilities. We are not against, we need healthcare facilities. Nurses need jobs. We, you know, some of my people on my board need jobs. Okay. So please, they have that insight. They have the training. They're learning stuff from me, and they'll be happy to help you make your work environment an even better place. So please don't demonize anybody that is working with Nurses Against Violence Unite, because we are not here to destroy employers. We love what we do. We take ownership for what we do and listen to what we have to say. We're not a union. We're not planning on becoming a union, but what we're going to work on trying to get into your healthcare facility to make it a better place. And that is our goal. That is our goal. And that is our mission, to help the mental health of not only healthcare workers, but also the patients that we work with on a daily basis, because we owe that. That's why we became nurses. That is what we do. We love what we do. So with that being said, do you guys have anything additional that you would like to say? Because we can talk about this all day. I love talking with you guys. We can definitely make this thing go on and on and on. And we're going to start picking back up with our webinars. And I would like to have start something with informational, like, education type things to start giving the general public about what, illnesses and the things to look out for and stuff like that. So this is something new that we're going to be incorporating with Nurses Against Violence, because it's very important that we build a presence and build the trust of our population that's out there that is also dealing with trauma.
Right.
Okay. Because they're isolated. They're scared.
Right.
I do have one thing to say. If you don't know that you're not okay, but things are different, you're approaching your life different, you're seeing things differently, ask a friend of yours, ask your mom, ask your dad, ask your grandparent, hey, do you notice anything? Like, I'm noticing this. It is a lot of people who have suffered through trauma before tend to recognize the signs of trauma a second time a little easier than someone who never has before. It is a mindset and it is hard to get out of. You are not alone. There is help out there.
I would
Please.
like to piggyback on what you're saying, Miss Deanna, and I'm sorry if I interrupt, because
I'm done.
what you're saying, I don't want to like lose my train of thought, because you guys know that I'm really good at that. What I want to make sure that everybody knows out there, yes, talk to your friends and family, but do they really understand what you're going through as a healthcare worker? So that's what we're here for. Nurses Against Violence, we know what you're going through in some degree. And if we don't, then we will match you with somebody and find somebody else that can help you, and that you both can get together and have these conversations and just decompress, because you know what, that's a whole part of healing. And that is what we want to do. And, there's no charge for doing that. We do accept donations. It's helping us to, put on more programs and put things on and give and do our giveaways. Like, we're going to do a giveaway, not this week, but we're going to give away some more stuff coming up next week. So, we are here and we're staying. So I want to make sure that everybody understands that if somebody at home doesn't understand what you're doing, or you feel like they're minimizing what's happening, or you're scared to talk to them, you can even message me, Dr. Rizaldi or Sandra Rizaldi. You'll see me in the group. Message me. It's okay. I'm not gonna, I might ask you a couple questions, because I want to get to know you, right? It's called building relationships. So, what do you guys got to say about that?
I agree. I agree. And I just wanted to kind of piggyback off of what you said, Dr. Sandy, because sometimes we are fortunate enough to have people that aren't in healthcare catch on one of our webinars. And I would ask that if you are in healthcare, but you have a lot of family who don't understand what's going on, tag them in this video. Maybe they'll get a better understanding of what we're actually up against and what you're fighting for too out there on the front lines with me. I mean, I'm fortunate because after a year of fighting the COVID battle, I get to step away from the bedside and take a much needed break. But not everybody is as fortunate, and I recognize that as well. So have your families watch this, have them come to understand, talk to them about what PTSD is, talk to them about it, so that if it starts to affect you, they might be the ones to recognize it before you do.
Exactly. Like, something's off with your pattern. Let's talk about it.
To draw a parallel, a lot of people associate PTSD with veterans and war and everything. And it's a well-known fact that 22 veterans a day die of suicide. It's not okay. I really don't want to see nursing get to that point.
It is getting to that point. It is. There are statistics that are coming up, and our mission, as I'm sure you're getting ready to say, I'll let you finish, but there's the statistics are rising. I've posted articles. It's getting, what we're doing right now with Nurses Against Violence Unite, people are watching us. People are watching what we're doing. And it's very important that people out there know that we love them, because we truly do.
We're a lot more connected than you think. You're more connected than you think, even if you feel stranded and alone.
Right.
Mhm.
Even if you can't talk to your home family about this, you can talk to this family about it.
Absolutely.
Say, I need help. Just say, I need help. I need somebody to talk to. Can I have your ear? And we will, if we can't do it right at that moment, we will definitely talk with you that day.
Right. And
You have to take that step. Exactly.
I'll cry with you, laugh with you, cuss the imaginary facility out with you.
Or teach you a little bit about scream therapy and how much therapy it can bring.
Right, exactly.
Laugh a little bit, be obnoxious a little bit, be a clown. You know, I'm goofy as all can be. People
Make
just
you
don't know
feel
that
seen
about
and
me.
heard.
Yeah, exactly. And I have no problems when summertime comes around. If I'm still here by a huge, well-known facility, I plan on making a lot of noise.
Yeah. Well, and just like, I think a lot of
Fun
the
noise.
too, when we're talking about trauma too, Sandy, just to kind of wrap it back around, I was just dwelling on it because my mind is stuck there at the moment because I'm broken.
Only for a second.
Only
okay.
right now.
Mhm.
But PTSD can present itself in a lot of ways, like inappropriate humor, continuous dark humor, a lack of sleep, poor quality of sleep, like waking up frequently overnight, change in your appetite, change in your weight, change in your patience level and tolerance,
Pain hurting more than it should,
increases in how often you sleep. And that's kind of what tipped me off is I just had, if I wasn't at work, I was literally overeating or sleeping.
I absolutely love this because you know what? I was telling a patient that said literally everything on her body was hurting her, and I'm sitting here doing the Dr. Sandy when I'm like working a triage line as a nurse, as a registered nurse, and it's funny because it's just like I gotta put that hat away, but that pain, that lady, that patient was laughing. She was like, I think I need to get a weed card. I need to get an opioid. I don't know what kind. And I look and I see drinking is her past history. I'm like, ma'am, we need to talk.
Right.
We need to talk.
Yeah. You reminded me of that commercial from, I don't even know how long ago it was, where they're walking and it's like a little cartoon and they have the umbrella and it's like raining on the umbrella and they're like, where does your depression hurt? That's exactly what that reminds me of.
It's like all of it. It's like, and hers was like everything hurt. Her finger hurt, all this pain. And when you said that, Deanna, that brought back that conversation. Matter of fact, just today. And it's like, I think it's almost like it's helping me with, my next role as the nurse practitioner, doctoral, whatever. And being able to do and learn the system and to talk to people on a different kind of level, not being able to pick up on all of these things without even having to look at them. And that's kind of scary in a way, but knowing who I am and what my abilities are, I could pick up on so many things. That lady was laughing. She was having so much fun. And she's like, you know what? I do need a psychiatrist. I talked to somebody, but he can't help me with, I was like, there's non-narcotic things out there that could help you with your pain. And I was like, maybe you need to laugh a little more. Maybe you need to find some joy, get a dog, do whatever you can. She's like, I got a dog. And I'm like, yay, do whatever you have to do to make yourself okay. And it takes time and baby steps from that point forward. And I know there's a couple people listening to us right now. And when I say baby steps, I mean baby steps, half inch, quarter of an inch, as long as you're moving forward.
The next foot forward.
And that's a big thing right there.
And even if that next foot forward ends with you face down,
you still made that step. Just like Stella going into the snow and then going face. She still made that step. So yeah, our mascot, she is teaching us all kinds of things. But so without further ado, I thank you ladies for coming on with me tonight. And I think you can kind of tell we're taking this thing and we're reinventing Nurses Against Violence. We need to have a lot of education that we need to do when it comes to not only helping our crew, but also helping those that are out there that are hurting. And once we can help the public as well as our crew, which is our community, we're gonna see a lot of movement, and we'll probably end up having more, being able to help more nurses on every level. So
Absolutely.
I want to thank you guys for coming. I know this has gone over as it always does, and I want you guys to have a great week and see you next week. And thank you so much for coming on with me tonight.
Thank
As
you for
always,
having us.
Have a good one.
All right. Good night.